Good morning, everybody. Before I start, I'd like to acknowledge the traditional owners and custodians of the land and elders past and present. Technology. Thanks for all this. This is really good background to what I guess my role is trying to say, what we're going to do as a Yunus social business health hub. And this has been read out to you. That's what the Yunus Social Business Center does. So I won't bore you with it, but health, education, environmental issues, and renewable energy are listed on the website of the Yunus Business Center, global initiative. Now, how did it come about? There's a bit of history that Peter Noble outlined. They started with a whole lot of activities done by the Asia Pacific Ubiquitous Health Research Center led by Professor Pradeep Ray on M-Health assessment in Indonesia, India, China, Philippines, Bangladesh, and Papua New Guinea. It examined the use of mobile phones in public health issues such as TB, HIV treatment, smoking cessation, and as mentioned, disaster management, and it was involved in the Aceh problem at that time. As a result of some of these activities, the WHO designated us as a WHO collaborating center with a focus on e-health. And because of the work done in Bangladesh in M-Health assessment by Shari Akhtar, who will be one of the panelists, and the discussion and the engagement with the Yunus Business Center and the Grameen Bank core center, it led to the formation of the engagement to form a Yunus Social Business Center in University of New South Wales. And as has been mentioned before, the rest is history. Hopefully we'll make it work. Just a little bit to show the strong connection we have with Bangladesh. This is a bit busy, but I just thought it'd be good there because I'm sure Bangladeshis are very proud of the International Diarrheal Disease Research Center, which is kind of, I'm not sure how many know that the use of coconut water and stuff in IV rehydration is a pioneering change. But it just highlights why there's a whole bunch of, and we look at the last dot point, 20 M-Health initiatives in Bangladesh as part of the Digital Bangladesh initiative. But Fatima is one of our PhD students, and this is what her PhD is currently about. How ready is the Bangladeshi community in a rural setting is ready for M-Health? So this kind of highlights some of the things we'd like to build on. So with that background, and you've heard all the background things, the Yunus Social Business Health Hub. What should it look like? What should it do? Why should it do it? And what for? And who for? These are some of the questions that I guess we need to ask. And these are some of the questions I want to ask the panel to have a bit of interaction with you, the people who have expressed interest by turning up today. What's it going to be? All right? So with this kind of background, I'm thinking of just a work plan, just a framework, an outline for a framework. I guess the first aim would be to support the Yunus Social Business Center's social business approaches to improve health literacy, and access. Okay, so that's been touched on previously. Improve social business through social media and networks. Touched on again by Professor Noble. Research and development to support the above roles. Try to establish a theory and a science, which is what university centers are supposed to do, all right, to base and ground our work in theory. And I went a little bit further and developed a matrix as a strawman, as a kind of outline of what we like to do. It's a bit busy, but I'll just take a couple of minutes just to explain to you. The middle column is the attributes of Yunus social business centers. Okay, not-for-profit, sustainable. Business principles, bottom line. Achieve social objectives, all right, so that's a key aim, as Professor Yunus mentioned. And the profit is used to expand outreach, to improve access, and to increase the social impact. So that's kind of the broad kind of terms of reference that the Yunus Social Business Health Hub kind of would have to work within. And the plan I've shown you just now Okay, and the first column, support Yunus business centers, social business with digital approaches, social networks empower crowds, exploit and understand how to use it, how to explain it, generate the evidence, establish a theory and a science, and then you can see a bit, but basically the implementation part of it. Plan, adapt, or build tools and applications to help the community, the social business community, to do it. And I guess some of the things across each of the things of each of the, I guess the plan of work. So we need the community readiness stuff that I highlighted that our PhD students doing, and hopefully further PhDs and master students will do. Readiness to adopt mHealth, health information and services, how we actually kind of help the social business centers to do it. Okay, some of the issues are some of the things to do with social networks, with young people especially. Phones, tablets, monitoring devices, and mHealth. These are some of the important things happening in developing countries. It is what we call a leapfrog technology. All right, that's infrastructure cost of wires and kind of the traditional information infrastructure costs a lot of money. Wireless has been a huge kind of a watershed. And that's the basis, and that's where I guess to an extent, mHealth in developing countries has got a slightly different focus on access and equity compared to mHealth in more developed countries, right, which has got slightly different focus, okay? So we'll explore those kind of issues, hopefully, as part of the Health Hub. So crowdsourcing and so on, with rigorous educational and research development to help us generate the evidence, help through a systematic program to try to understand how social business, social networks, and health actually engage together and complement one another and actually take us to the next level. So at the end, I guess maybe mHealth can be a social business itself. And as I said, I took the time to go through this because this is what the interactive session is about, to help us engage you in an interactive session to suggest what the Health Hub should look like and should be, and what for. Thank you.